and welcome to this, your key points from the great webinar, which we've just had with Amy Skip, all about what health can learn from the field of special educational needs. My name's Richard Taunt.
I'm Anna Howells.
And in terms of key point for me, is that Amy presented a whole range of lessons from outside healthcare, which you could have scrubbed off the top and just put healthcare. A lot of it looked very, very similar, which I think is actually a really important point, that we often look to other fields, other contexts, as maybe they'll have the magic bullet which will solve our problems. But no, often change, as Amy says, is about a whole set of concepts which are simple to say and not so easy to do. And what matters is commitment to those set of principles. So I think actually a really important lesson just for us to think a bit more about. Anna.
Thank you. Yeah, so Amy's key point from the discussion was around presumption and how, because we don't often bring kind of health and education together to have these conversations, it's easier to assume that one person's doing one thing or another's working on something different. So bringing those together to have those conversations. And then my key takeaway was around there are lots of similarities, but in terms of how we share best practice in health, some of the key lessons we can learn from education there.
Anna, thank you very much indeed. This was part of our event series, Cold Change in a Cold Climate, all about change in the NHS. There's a whole range of events coming up, both digital and face-to-face, which we hope you'll join us at. Website to go to is kaleidoscope.healthcare/change. And it's great that we're doing this event series as us, Kaleidoscope, in partnership with AbbVie. Thanks very much for watching. Hope to see you at a future event.